Hi, I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas. I want to talk to you about an ingredient in fish oil and its effects on cardiovascular health. The ingredient is called eicosapentaenoic acid, more commonly known as EPA, but there are actually two major biologically active fish oils in both over-the-counter fish oil and in pharmaceutical quality fish oil. One is EPA and the second is DHA or docosahexaenoic acid. These are both polyunsaturated fatty acids and essential nutrients for your body's metabolism. In fact, clinical studies are now showing positive benefits of fish oil to the heart, especially for people at high risk of cardiovascular disease and for those who already have established cardiovascular disease. For example, in the GISI-3 study, 1 gram of the combination of EPA and DHA was shown to reduce cardiovascular events in both men and women who had survived a heart attack. At the time of this study, virtually none of the patients were receiving cholesterol-lowering medications with statin therapy. In the past many years, other important studies were performed in patients with established cardiovascular disease or who were at high risk for developing cardiovascular disease because of the presence of diabetes and at least one other risk factor such as tobacco use, high blood pressure, high cholesterol, and the like. In the REDUCE-IT clinical study, medical scientists conducted research on 8,179 patients. 71% of these patients already had established cardiovascular disease such as previous heart attack, stroke, peripheral artery disease, and the like. 29% of these patients had diabetes, that is, their body does not regulate the amount of glucose in the blood, and they had one other risk factor, such as those mentioned earlier. All patients were a minimum of 45 years of age and older, and all patients in the study were on statin medications at the highest dose tolerated. Patients were then split into two groups. One group received a mineral oil placebo, while the other group received 2 grams of pure EPA twice a day. Not a combination of DHA and EPA, just pure EPA. The baseline average total cholesterol was 157 milligrams per cent. The baseline average triglyceride level was 216, and the baseline average HDL cholesterol was 40 milligrams per cent. The triglycerides in the EPA group dropped an average of 39 milligrams per cent, while the average triglycerides increased 2 milligrams per cent in the placebo group. The average LDL cholesterol increased 2 milligrams per cent in the EPA group and increased by 7 milligrams per cent in the placebo group. There was no change in the HDL cholesterol. The therapy with EPA was well tolerated, and only 7% in both groups dropped out of the study. After 4.9 years, there was a 25% reduction in cardiovascular deaths, non-fatal strokes and heart attacks, and emergency revascularization with bypass surgery or angioplasty with stents. With respect to cardiovascular deaths, there is a 20% reduction and a significant reduction in all-cause mortality. As you can see from the figure, the two curves started to change after 1 year of therapy. There is a spreading difference of benefit with increasing time after this point. In terms of side effects, there was a small increase in the development of atrial fibrillation in the group receiving EPA, 3.1% versus 2.1%, or a 1% difference. There is a small increase in risk of bleeding, with 2.7% of the patients having bleeding in the EPA group compared with 2.1% in the placebo group. In addition, heartburn or GERD can occur. They looked at subsets of patients in the study. There was similar improvement in men and women. There was similar improvement in patients with and without diabetes. There was similar improvement in patients with established cardiovascular disease, age, baseline, and triglycerides did not affect the benefit of therapy. Of tremendous interest was a similar study done in a similar large group of patients, but they used 4 grams of fish oil, which contained roughly equal amounts of both EPA and DHA. The combination of EPA and DHA did not improve cardiovascular events at all. What is the take-home message for these studies? If you have established cardiovascular disease and are on maximally tolerated statin, and your triglyceride level is greater than or equal to 135 milligrams per cent, I'm going to recommend that you take 2 grams of EPA, such as Vasipa, twice a day. If you have diabetes and one other risk factor, and you are also on maximally tolerated statin, and your triglyceride level is greater than or equal to 135 milligrams per cent, I am also going to recommend that you take 2 grams of EPA 2 times a day. I hope this educational program has helped you understand why I may be prescribing EPA for you. This is Dr. Eli Whitney with the Heart and Vascular Institute of Texas.